So that's pretty important for men, wouldn't you say, John?
100%.
I mean, you're a man.
I'm a man.
Okay, so sexual function, not that you're sexually active, but you always want that. You always want that possibility.
It's another
right?
topic of discussion, doctor.
Right. We don't talk about those things at 6:40 in the morning. But for men who are sexually functional before prostate cancer surgery, with open surgery, only 2% of men, 2.9% of men were sexually functional normally. Everyone else had adverse effects.
I don't like those odds.
97% had damaged their sexual function one way or another with open surgery, and 98% had damage to their sexual function with robotic surgery.
Not very good odds, right, Ariel?
So it's,
not at all.
We're in
so
agreement.
it's pretty clear that this robotic device is not doing what it's promised. The idea was you could see every nerve, see every blood vessel, and avoid harm. And you can see that the vast majority of men had harm to their sexual function, which is no joke, no laughing matter. It's a serious matter. And with urinary control, if you had open surgery, 81% of men were adversely affected. So they had problems controlling their urine with open surgery. And if you had robotic surgery, 87% of men had some sort of damage to urinary control. So the data isn't showing that robotic is better. It seems to be worse than open surgery. The cancer rate, and we've got data from a very famous doctor in New York, he wrote about his patient that he knows that the results are no better than open surgery. No, we have results that are much better than open surgery. I mean, just for example, for a man who called us this week with a PSA of 15.
That's pretty high risk.
Yeah, PSA is prostatic specific antigen. He had prostate cancer. If he went to have open surgery by the most famous urologist in New York, his chance of being cancer-free at 5 years was 69%. With us, it's 86%, which is 25% higher.
Odds that I would want on my side.
So you want to be 25% higher, you come to us for a special program, body radiosurgery and brachytherapy, and we kind of designed the treatment for each man. So some men call and say, well, what will you do for me? I don't know what I do for you. You have to come in. We spend an hour or two. We take it seriously. It's not cookie cutter. It's not like you go to proton beam and everyone gets proton beam.
Yeah.
You go to robotic surgery, everyone gets robotic surgery. No, and it shouldn't be that way. There's some men that don't need cancer treatment. I had a man last night who came to me, and hopefully he's listening to the show. He's got a beautiful wife. He's in the fruit business in Queens. His PSA was 1.8, and it rose to 3.1. He's 55 years old. He works out every day. And he came to me, and he wanted to know, should he have a biopsy or not? And I told him, look, he has no symptoms. His stream is fine. He has no pain. He has no bleeding. His PSA is still pretty low. Yes, it's gone up a bit. It's gone up from basically 2 to 3. I told him if I was me, I'd probably not have the biopsy. He's 55 years old. He's fully functional. There's a small chance he'll have cancer.
No symptoms with his...
We can never say no chance, but there's a small chance. We can follow him over time. He has a beautiful wife. He has business life. I mean, why does he want to take a risk when he has very little risk of doing a biopsy?
Sure.
So we tell every man different news. Some men need treatment. They come with a high-grade cancer, a high Gleason score, a high PSA, and they need treatment because they don't want to die.
Yeah.
And they don't want the pain.
And they don't want pain. And they don't want the complications of surgery. So we try to show people that surgery has big risks. The chance of success is less, much less than with us. And people are led to believe that if you operate on a prostate, you're home free.
They haven't been to surgery.
But they're not home free. In fact, the surgery just starts the complications. It spreads the cancer cells often. It can adversely affect sexual function, urinary function. So please, you can call us. We have a booklet that we give for free. It's called Prostate Cancer, and a DVD we'll send to you at no charge if you call us during the week at 212-CHOICES. People like the book, and I'm happy to speak to you. It's really best to come and speak in person. So what do you think about that, Ariel?
Interesting. Any other patients you've seen this week?
Yeah, just before I get to other patients, I want to talk about this article that was in Wall Street Journal yesterday. And there's a company that makes a robotic device. Now, you would think if the
Who's
robot...
behind the puppet, Doc?
Who's behind the puppet?
Who's behind the puppet?
Now, you'd think if this puppet is doing the right thing, the company would be doing great.
Right. That's what we in hopes.
Well, what's the headlines in the Wall Street Journal say? Intuitive surgical profit falls as sales weaken. In the article is struggling robotic surgery company, Intuit Surgical, had another disappointing performance in the third quarter. Earnings fell. Customers had concern about safety, and we've spoken about that before, that there's reports about damage to the rectum and damage to the colon, perforations during surgery.
Right.
And again, if a machine's doing the operation, the machine can't feel when it starts going through your rectum and going through your bowel, and the damage is terrible because you have the contents of the bowel that leaks into your abdominal cavity. It's catastrophic, could even be fatal.
Mm-hmm. It's a perfect site for infection.
It's called peritonitis, and it's really severe, and there's some reports of people in the hospital for weeks, sometimes even more than that, and sometimes not even getting a full recovery. So the shares on Wall Street fell of this company. There's been lots of criticism over the cost of the machine, which is in the millions of dollars. There's criticism of the success, or let's say the so-called success. So the company's on the ropes, which is good. They should finally have to tell the true facts about complications. We should understand that it's not the magic bullet. It doesn't do something that other methods of treatment don't do, other than goes in there without human hands, so you can't feel, you can cause complications, and you have a failure rate that's much higher than with other methods of treatment. Yeah. So I'd urge people, please give me a call when you wish, either on the radio show or during the week at 212-CHOICES, which is our direct number.
Right to Dr. Lederman, 212-CHOICES, as we found out, comes right to his cell phone.
Well, it does. I was on WOR last week, and the phone lines were down. Everyone was calling me on my cell phone. We're going to go to a word from our sponsor. The sponsor is incredible.
Ariel, you might know this gentleman.
What do we call the sponsor?
The man with the golden voice.
The man with the golden voice.
And when we return, give us a call, 800-848-9222. We are live here in New York, WABC Studios.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
We're back. Welcome, everybody. We had a lot of interesting cases I wanted to talk about this week. I know we only have a few minutes left. We treat a lot of head and neck cancers. Head and neck cancers are the cancers of the throat.